Well, a warm welcome to today's video. It's Sunday the 17th of May. Now, I just want to read a statement released by the World Health Organization on the 14th of May. A mental illness crisis is looming as millions of people worldwide are surrounded by death and disease and forced into isolation, poverty and anxiety by the pandemic. So the World Health Organization and the United Nations are flagging up that mental health is a great problem at the moment. So we have a pandemic of COVID-19, of course, everyone knows that. But it looks like we're getting a superimposed pandemic of mental distress and mental illness, in many ways linked to the current pandemic. And this is something that we need to address. Now, I have had problems with anxiety and depression in the past. Many of you have. And if you know anyone at all, unless you're a complete hermit, if you haven't had mental health problems such as anxiety and depression yourself, it's a guarantee that someone you know will have suffered from this. Whether it's a family member, a friend, an acquaintance, you'll have known someone who suffered from this problem. So I believe this is something we all need to know about. Now I'm going to talk a little bit about the scope of the problem, and then I'm going to give you some things that I personally find helpful and have found helpful when I've had problems with anxiety and depression. So if you want to stick around for that, then that would be wonderful. If you want to skip this video if mental health isn't your thing, then skip it and we'll see you tomorrow. But you are going to come into contact with mental health problems. You may suffer from it yourself, and you're certainly going to come across people suffering from it. And it really is a good thing if you are in a position to help. So the World Health Organization and the United Nations go on. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. Now, they're using the term here, misery. This is a miserable situation to be in. Very strong language here from the United Nations. And I agree with it completely. Even when the pandemic is brought under control, grief, anxiety and depression will continue to affect people and communities. And again, I agree with the United Nations here, because even though the lockdown is starting to be lifted now in many Western areas, the disease is still getting worse in many other parts of the world. And even when the lockdown finishes and the disease goes away, the mental side doesn't snap back into place straight away. It can take time. There can be ongoing effects. So this is something we all need to know about. The United Nations report also says the mental health and well-being of whole societies have been severely impacted by this crisis and are a priority to be addressed urgently. So you and me today are addressing this, I hope, in some meaningful way. The United Nations is strongly committed to creating a world in which everyone, everywhere, has someone to turn to for psychological support. Now, sometimes that someone that we need to turn to might be a mental health professional. But other times, the person that is turned to may be you. Or the person that you turn to may be a relative or a friend. But very often, someone is going to turn to you for help and support. And I'm hoping that this is going to put you in a position where you're more able to do that. That is the hope of this video. I was actually a psychiatric nurse a long time ago when I was young. Haven't done it for a long time, but of course mental health comes into everything, and having been working in healthcare for 42 years, I've come to realise it's completely impossible really to separate mental illness and physical well-being. The two so often go together. Now let's just have a quick look at this survey now. Now these are surveys. The national surveys in 2020 reveal high prevalence. In other words, there's a lot of it about, of distress. So distress is a strong word. It's a strong word, distress, in the population during COVID-19. Now the People's Republic of China, 35% of people reported feeling distress. This is just a huge number. It's really quite an alarming number. 35%, over a third of the population feeling some level of distress. That's concerning, but things get worse. In Iran, 60% of the population have been feeling some degree of distress, mental distress. In other words, it means only 40% of the population aren't. And in the United States, the figure is 45%. So 45% of people in the United States have reported feeling mental distress. So we can see this is a very significant issue and affecting huge numbers of people, and something everyone needs to have at least some basic knowledge of, so you're in a position to help and be in a position to realise when you need help. I find giving help relatively easy. I find asking for help incredibly difficult. And maybe some of you are in that position, but there's times when we all need help. Certainly times when I need help, that's for sure. Now, plenty of references for today's material, so do look at those at your leisure. And obviously I'll post all of this, including the notes, in the description. Now, COVID-19 virus not only attacking physical health, but attacking mental health and well-being as well. These two pandemics are going together. And this is giving rise to psychological suffering. Now, note that word suffering. Suffering. If you have had a period of depression or anxiety, it is a form of suffering, just the same as physical suffering. The suffering is quite genuine. It is real suffering. People are suffering from grief of loss of loved ones, shock at the loss of a job, isolation and restriction on movements. So all of these things are causing psychological suffering, but there's something else that I've noticed, and that is that sometimes the way you're feeling is proportionate to the difficulty you are experiencing. But other times, the distress that you're feeling is disproportionate to the difficulty you might be in. So I've been in very difficult, dangerous situations a few times and felt very little anxiety at the time. But I've been in situations where life was actually pretty good, but I actually felt quite a lot of anxiety. So it's not always proportionate, because we tend to look at someone else's situation and say, well, you know, they've got a house to live in and they've got a bit of money and, you know, they've got use of a car every other day. They're actually not too badly off, therefore they should be okay. But it's not necessarily the case, because the way you feel can be somewhat disconnected from your environment. But what this United Nations report is saying, that the difficulties we're having at the moment are exacerbating these difficulties and making it worse, and the environment is having an adverse effect. But of course, it's always an interaction between the environment and the mind. So all of these things causing levels of suffering. Family difficulties, especially when people are together, especially if there's a shortage of resources, if money's tight, if you can't go out, if money is even absent in some cases. And unfortunately, the United Nations is reporting a global rise in domestic violence. Now, quite what we do about this is difficult to say. Of course, we have to try and sort our own households out as well. If there's a violent member of the family, that needs to be addressed, and there needs to be realisation of that and coping strategies. But as well as that, if you know someone who is at risk, then make sure you keep communicating with them. Outside accountability is very important. Or if you know someone who is at risk of committing domestic violence, then communicate with them and try and work out strategies to minimise the possibility of further domestic violence occurring. Have a high index of suspicion for domestic violence, because domestic violence is probably going on near you now, just that it's often a hidden epidemic. There's uncertainty and fear for the future just now, of course. People don't quite know what's going to be happening to them, to their families. all adding to the difficulties. Health workers are reporting an increased need for psychological support in healthcare workers and in the general population. People are needing psychological support. And the main way people get psychological support is from other people. So you need to look around for people that you can psychologically support and accept psychological support from them. Humans are intrinsically gregarious. This is what we do. We live in communities. We can't live outside communities. I can't live outside of communities. I'm dependent on other people. And it's also true for the vast majority of you as well. Not many people can live as isolated hermits. Now, the World Health Organization is describing panic, anxiety, grief, numbness, irritability, difficulty sleeping, and bad dreams. Maybe you can relate to some of these at the moment. Maybe you know people who can relate to some of these at the moment. And mental difficulties can be particularly problematic. So just a couple, I'm not going to throw too much philosophy at you, but a bit seems appropriate. My spirit is broken, my days are cut short, the grave awaits me. That was someone called Job who said that. And basically, can you see the guy's desperate here? He can't see any hope. He's just waiting to die. Life has become without hope. And this, of course, is part of depression. We don't see hope. When you're depressed, you become incapable of seeing that the glass is half full. The glass is always half empty. Two men looked out of prison bars. One saw mud, the other saw stars. You can only see the mud. You can't see the stars. There is no hope. Or there is hope, but the depressed person feels like there is no hope. The human spirit can endure in sickness. And you can relate to that. If you've been feeling reasonably okay mentally, but you've been ill or you've been in pain, then you can work through that. I had a period after an accident and I was in a lot of pain for 6 weeks. But, because my psyche was okay, I worked through it. I was able to cope with that. It was unpleasant, and sometimes I had to take medication and have a lot of modifications of lifestyle to deal with it. But, I was able to cope with it. Now, sometimes, of course, pain is intolerable. It's not always true. But the human spirit can endure in sickness, but a crushed spirit who can bear? So, if you feel crushed and you feel wretched, then that takes power away from you. You can't do anything. It's immobilizing, or it certainly can be. And I'm also going to talk about alcohol, which is not a laughing matter by any means. So that's what we're going to talk about. Now, the things I've found helpful. Now, what I'm going to do is I like to sort of keep a track of things. So let me show you how I do it. So I'm going to give you these references. And this is a PHQ-9, Public Health Questionnaire 9. Now, you can print these out, or you can do them on the computer screen. And you can evaluate the status of your mental health at a particular period of time. So what I find useful, and this might not surprise you because if you've watched these videos, you kind of know the way I think now. But what I find useful is to have a diary. So you could do this. So this is the diary of John's mood. This is how I'm feeling. And this is going to be my score in this Public Health Questionnaire 9 for my depression. And this is going to be an estimate of my GAD, Generalised Anxiety Disorder 7, which is another assessment I want to show you. And what we'll have is we'll have a number for each of these, and we can plot my progress during the week, and we can see how I get on. And if you're having a difficult period, I really would advise doing this, because it gives you sort of some objectivity back into the way that you're thinking about yourself. So first of all, let's look at this generalised anxiety. The first one is the depression. The depression score, Public Health Questionnaire 9. And of course, I've got the link here. Now, I found this a remarkably useful tool. I find it helpful to give me insight. Now, it says it's for professionals, but we're allowed to use it as well, so don't worry. Now, the screening tool for depression, the original one, the PHQ-2, can be used, but this one's better. This is the PHQ-9. But the original one had a 97% sensitivity and a 67% specificity. So that is actually good. So the sensitivity means that false negatives are unlikely. So the tool will not say you are not depressed when actually you are depressed. And the specificity of this is also reasonably good. In other words, false positives are unlikely. It's specific to depression. It will not say you are depressed when you are not depressed. So that's the way that's the way that's working. Now let's make a start. And what I'm going to do is I'm going to fill this out as we go down. Now, little interest or pleasure in doing things. So it's normal to be interested in things, and it's normal to take pleasure in things. We're supposed to get enjoyment out of life. So if you are finding things that you used to find interesting boring, and you're not interested in things anymore, and when you do things that you used to enjoy, you're finding little pleasure in them anymore, whatever it is, whether it's eating, whether it's going out for a walk, whether it's making love, whatever it is, if you're finding little pleasure in that, then that's abnormal. So losing interest in things or not taking pleasure in things is not normal. Now, the key thing about this is this score acknowledges that depression varies from day to day. And this is very important to realise. So if someone's depressed, sometimes they have good days and sometimes they have bad days. Now, we all have good days and bad days. How's your day today? You could probably classify it as really bad, not too bad, kind of okay, pretty good, really good, extremely good. You could classify what kind of day you're having. So we all have better days and not so good days, of course we do. But in depression, that's also true. So it varies from day to day. It's not usually a constant condition. Now, I have seen people in depressive stupors where they are acutely, severely depressed. But for most people, you have good days and bad days, and it's the same. It's the same usually in depression. So the question is, how many good days and how many bad days? So at the moment, I think I'll go for several days on that. Sometimes the odd day I lose interest in things and don't take pleasure in things. That's probably true. Feeling down, depressed or hopeless. So low mood, feeling down and depressed. And one of the worst things about depression is this feeling of hopelessness. Now, this is why people often don't seek medical advice when they're depressed. They just think that they are so bad. My situation is so hopeless.